Thank you for taking the time to learn more about the aged care quality standards and how they affect you and your Meals on Wheels services. As a care provider in the aged, disability and community sectors, we must meet certain standards under our funding contracts. Within Queensland, the Human Services Quality Framework exists to ensure quality service is provided under state-funded programs such as the Queensland Community Support Scheme. Federally funded programs fall under two quality systems, being the Aged Care Quality Standards and the NDIS Quality and Safeguarding Framework. All three standards are audited through different systems for providers of programs that fall within their scope. All Meals on Wheels services successfully audited under the Aged Care Quality Standards will be recognised by the Queensland Government to also have met their requirements under the Human Services Quality Framework. A verification or desktop audit under the NDIS Quality Safeguarding Framework only requires documentation to be returned to show compliance against this framework. The Aged Care Quality and Safety Commission is responsible for ensuring providers, including residential care facilities and their operators, home care package providers and Commonwealth Home Support Program contract holders, meet requirements of the Aged Care Quality Standards. A single set of standards is applied proportionally across the aged care sector, depending on the service types the organisation provides. There are 8 standards in total. Standards 3 and 5, which cover personal and clinical care services and the service environment, are not relevant to Meals on Wheels. This course takes you through each of the other applicable standards.
I am treated with dignity and respect. I can maintain my identity. I can make informed choices about my care and services and live the life I choose.
Well, dignity and respect means that I can get along with the people, they can get along with me, I can ask them any questions and they're able to tell me or advise me as to how I should go about it. It's a real mutual sort of an arrangement. What meal would you like?
Roast pork.
Meals on Wheels endeavours to treat all clients with dignity and respect and support them to make decisions and exercise choice around menu items and delivery of meals that best suit them. It means we need to consider our clients' identity, culture, diversity, independence, privacy, and their own ability to make choices in the management of their services. So you may need to adjust your routines or habits to ensure a culturally safe service is provided. An example of this is eye contact. Some cultures prefer not to use direct eye contact, so we need to respect this. Dignity and respect also means we may need to discuss risks involved with their decisions so they can make an informed choice.
Hello Nancy, you home? Meals on Wheels.
For example, if a client wants 2 hot meals delivered each day, so they can have one for lunch and one for dinner, it's important to explain the food safety risk if a meal is delivered hot but not eaten immediately. Suggest an alternative, such as providing a frozen meal that they can reheat later. We also need to keep our clients informed with current, accurate and timely information through newsletters, phone calls, notes, messages with volunteers, as well as giving clients the opportunity to communicate back with us through surveys and messages via delivery drivers. This is all underpinned by our feedback policy. Communication with a client over the phone should always be friendly and inclusive. It's important to take time to understand their needs.
Are there any food allergies or intolerances we need to be aware of?
My doctor said I need my meals cut up.
Okay, yep, we can cut up the meals for you, that's not a problem.
Come on, Johnny. Have a seat.
Thank you very much. Well, welcome to Meals on Wheels. It's nice to have you as a client now. So we've got some client information here for you. So this is a new client form for you. If you could sign that one and get that one back to us. So it's got all your information on there for us.
Yep, no worries.
This one as well, Charter of Aged Care Rights. So yeah, if you can sign that once you've had a read, that would be great.
Okay.
There's also some more information for that one in here. And then your client and carer's hand guide as well. So that's just got everything else Meals on Wheels related that you'll need to know. So the most important thing about how we treat our clients at Meals on Wheels is that we treat them the way that they want to be treated, so with dignity and respect, and that we give them the choice in the services that we deliver to them as well.
It's the little things we do to treat our clients with dignity and respect and involve them in the choices about their care that make the difference. As a Meals on Wheels service, we want to ensure all our clients feel respected and safe.
Thank you very much.
No problem.
I'm a partner in ongoing assessment and planning that helps me get the care and services I need for my health and well-being.
I like to be included in the planning because it gives me a choice of what I have for the day. I get 2 choices every day, and if I don't like either choice, then I can just go for a frozen meal. Oh, well, I do like to choose exactly what I want to eat, which I think is great.
The word assessment often makes us think of clinical assessment. But for Meals on Wheels, assessment is all about working out what the client needs so we can deliver safe and effective services that optimise health and well-being. And we do this every day.
Well, thank you. Wheels, remember me? Yep, lovely.
So Imogen, we've had a new client, Mr. John Michaels, call up. He's just come out of hospital after a surgery. He will be requiring soft and bite-sized meals in the interim till he gets back on his feet.
Information contained in referrals about a potential new client needs to be considered when we make contact for the first time, with particular emphasis placed on their needs and goals.
And so we'll make him a special meal. Are there any food preferences that we need to be aware of?
I don't like peas.
No, a lot of people don't like peas.
When a client contacts us for the first time, we need to ask for this information and record it effectively to assist in potentially having to place an online referral ourselves for the service.
Who can we send the invoice to, and preferably our email address?
The first conversation you have with a client is the first assessment we make. We find out what they need from us in regards to meals, including dietary requirements.
My doctor said I need my meals cut up.
And delivery needs. For example, what days do they require meals and how many meals each day?
Yep, Monday, Tuesday, Wednesday, Friday. So that's 4 meals. Would you like any?
At this time, we ask questions about how the client wishes to manage their service, who they want involved, who can speak on their behalf, and who we should contact in an emergency.
That would be Michelle.
Yes, and who's Michelle?
As well as any unusual things that may influence their delivery, like using the back door. This is the beginning of an ongoing partnership with the client, where they are at the centre of their own choices. This information is all recorded, and that record forms the client's care plan, whether it be paper-based, in the Mac portal, or in a meal management system.
So your first meal will be on Thursday. Our volunteers will be there between 10 a.m and 11 a.m.
Each time we make changes to this record, we do so as part of our ongoing care planning for the client. A change to preferences for a client is a change to their care plan. We just don't tend to call our records care plans. Annual client reviews and surveys of clients also form part of this process and may trigger changes to their care plan. It's important that we communicate these changes back to clients by providing them with a summary of their care plan or the changes we've made.
Got some information here for you, Jack.
This process may include other people such as family, health professionals or other care providers. It may also mean we need to refer the client to others for information.
I get the services and supports for daily living that are important for my health and well-being and that enable me to do the things I want to do.
Meals on Wheels keeps me healthy with good food and also makes it much easier for my life in my own home. They're flexible because they change the menus They help with things in the home, with communication and well-being.
Meals on Wheels.
Meals on Wheels is committed to providing a safe and effective service that supports the client's daily living needs, goals and preferences. We do this in two main parts. The meal, which is varied and of sustainable quality and quantity, and the welfare check, which provides an important social connection, a check-in and observation of how the client is each day we deliver.
You got a bit of help around the house? Yeah, that's good, that's good.
The meal should be prepared according to the client's preferences and offer choice. This includes such things as gluten-free, vegetarian, vegan, offering more than one meal choice per day. Familiarise yourself with our menu and understand what we offer our clients. Meals can be offered cook hot, cook chilled, or cook frozen. Providing a cook chilled or cook frozen meal allows the client the option to not have to eat it straight away. This gives them the dignity and independence of eating when they want to. Menus are prepared in accordance with the National Meal Guidelines, which provide kitchens with guidance on portion, nutrition and ingredients that make a well-balanced meal for our clients. Rotating our menu also provides clients with more variety and choice. Our commitment to food safety in our preparation and delivery of each and every meal is critical to our clients' well-being. Following our food safety programs ensures every meal we provide is safe. It includes equipment maintenance schedules for items such as baskets and eskies, temperature monitoring records, our cleaning schedules and preferred supplier lists. All of these records must be maintained and be ready for inspection at any time. The welfare check occurs at the time of delivery and provides invaluable peace of mind for the loved ones of our clients, and it supports the safety of our clients living in their homes. When the client receives the meals, we always need to ask how they are and ask if they're getting all the support they need. They may ask you to bring in the bin, collect the mail, or something else that's incidental and safe. These little things make a big difference to clients. It's more than just a meal.
Hey Owen, I wonder if you could check the light inside there.
Yeah, I can't check it for you unfortunately, but I can make a note.
That'd be great if you could do that. Thank you.
If a client request appears too risky, let them know you will inform Meals on Wheels management and someone will follow up with them. Always report back to the service if there was anything that you noticed or is said to you that may need following up with the client or through My Aged Care. This ensures timely referrals are made.
Hello Nance, it's Meals on Wheels, are you home?
If you make a delivery and a client doesn't answer the door, call your service immediately. There is a non-response process to follow, clearly outlined in our non-response policy. Please ensure you're familiar with your local non-response policy.
There's nobody home at Nance Morris's house. What would you like me to do?
The office will follow this procedure, which may include reaching out to their emergency contact, who will advise you what to do.
Okay, shall do. I'll put it back in the car. Thank you. See you later. Bye.
Your service coordinator will advise you of the next steps.
John, Meals on Wheels.
Sorry, I've fallen and can't get up.
Do you want me to come in and give you some help?
Yes, please.
If you find a client has fallen over, call 000 immediately. Then call your service and they will advise what to do next. This is considered best practice.
I feel safe and am encouraged and supported to give feedback and make complaints. I am engaged in processes to address my feedback and complaints, and appropriate action is taken.
There's not too often I need to have things changed, but I'm sure that if I wanted something changed, they would listen to me. I mean, they've always given me the opportunity to say, is there anything we can do for you, or is there anything you want to change or do? They've always asked that, but so far no. I feel confident in asking them questions, and not that I have to ask too many questions, but they're always quick to answer any questions I have. No, they're very good.
Seeking regular feedback and addressing complaints from our clients, volunteers and staff are all important parts of our commitment to continuous improvement. Our staff will adjust and adapt according to the needs, goals and preferences of our clients. We seek and receive feedback informally and formally through various methods: phone, email, face-to-face, or via an advocate or interpreter. Informally, a client may give us feedback at our delivery, saying, for example, their meal wasn't what they ordered, or they simply didn't like the taste.
I do definitely apologise for that, and I'll know for next week for you.
Good. Thank you very much.
That's all right, no worries at all. You enjoy the meals, the main thing.
This feedback should be provided to the service when you arrive back after your deliveries. It allows us to take appropriate action and use an open disclosure process if things don't go as well as expected. The kitchen and admin teams can discuss and plan how the issue can be improved. Our service will regularly issue a client survey, which will ask the client to rate their experience with our service. This may cover items such as menu choices, food quality and quantity, food presentation, and other issues or areas of support they may need. This feedback will be reviewed by the staff and committee and may result in menu changes, improved packaging or labelling, run changes, or whatever is necessary to make our service the best it can be. There are also formal complaints processes that the client, volunteers, staff, and other members of the public can use. This is outlined in our complaints and feedback policy and procedure, and recorded in our complaints and feedback register. It's important that we preserve confidentiality whenever a complaint is received, and ensure it's managed in line with our policies and procedures.
I get quality care and services when I need them from people who are knowledgeable, capable and caring.
The Meals on Wheels workforce may be made up of both paid staff and volunteers. All staff and volunteers are required to be trained and well skilled in the duties they undertake. Each role or position in a service requires a written position description that is up to date and reviewed regularly. This may be annually or every 6 months. It ensures the workforce is clear on the tasks they need to carry out. The workforce needs to be recruited according to our recruitment policy, which encourages people to be hired according to our merit and equity principles. The workforce needs to meet our core requirements for the role, ensuring they understand the need to provide all clients with respect and dignity. This starts with staff and volunteer induction, where the workforce is introduced to how we operate, including our compliance requirements with the aged care quality standards and health and safety and other applicable legislation. General training is provided online. You'll be provided time to complete the core requirements. Specific training will be required for people who conduct more technical roles in administration, such as how to use our meal management system, our finance system, and other operational tasks. Kitchen staff also require specific training, particularly in our meal operations and food safety. Volunteer drivers and deliverers need specific training in conducting the meal runs, meeting our food safety requirements, non-response policy, and pandemic protocols. Additional training will be required from time to time. Regularly monitoring our training requirements is an important function and accountability for our management team and committee. Staying up to date with our training competencies will ensure our every interaction with clients is safe and enjoyable.
Ongoing training means to me that I'm kept up to date with service delivery at Meals on Wheels, so it ensures that I can complete my job properly.
It also ensures that every person in our workforce is supported and equipped for their role. It's important that the service keeps a record of all training undertaken so our performance is continually reviewed, and so we can demonstrate our commitment to our workforce in delivering a safe, quality service every time.
I am confident the organisation is well run. I can partner in improving the delivery of care and services.
It is important that the service is run well because it helps to keep me in my home eating good food and helps make life better.
The committee is the governance body for the Meals on Wheels service. This means they're responsible for ensuring the policies and procedures are up to date and in place. Our risk register is regularly reviewed and tested, and our service performance is monitored so we're delivering a safe, quality meal, and we check in on our clients every time. This ensures a commitment to continuous improvement, where our practices will adapt and change as the environment around us changes. Our committee meets regularly to review performance and plan for future operations and requirements. Continuous improvement is the responsibility of everyone. This means if you see a problem or an area for improvement, you need to let the manager and the committee know. This will help us take feedback and improve our service. Our finances also are part of this governance and continuous improvement framework. This helps ensure we are viable and sustainable into the future. It means looking at our expenses and revenues regularly, our meal price, and our other activities such as maintenance and capital equipment requirements. Our finances are audited annually, which ensures our service is solvent, sustainable, and under control. Client and workforce complaints are also part of this environment. Responding to feedback and making the adjustments to our practices are signs of an organisation that is committed to improving our service. Cybersecurity is a growing risk and governance issue for Meals on Wheels. Do not provide any sensitive information to anyone outside the service, and do not respond to emails asking for sensitive information such as banking details. Ensuring we have a culture committed to our values and continuous improvement will give our clients the best service possible. We hope this training module has helped you gain a better understanding of the standards under which we operate and how they apply to your role at Meals on Wheels. Queensland Meals on Wheels provides support to all member services in meeting the obligations of these standards. As a service, should you need more assistance, please contact your Aged Care Planning Region contact at Queensland Meals on Wheels on 07 3205 5588 or via email info@qmow.org or approach your supervisor for support. Thank you for being part of Meals on Wheels.